Hello, everyone. I'm back today to talk about breast pain and breast pain solutions. In the previous two talks, we talked about breast pain being a big problem for women overall, and how we think about what's causing breast pain. And the reason why we're concerned about breast pain, of course, this is Breast Cancer Awareness Month. And we're concerned because um, we know from research that breast pain can indicate that maybe there's a lump or a bump there, and that can later calcify and turn into cancer. So we're concerned about trying to find it, but in conventional medicine, unfortunately, uh, they see a lot of women who say they have breast pain. They'll get a mammogram or an ultrasound, and then they just, when it's benign, they don't do anything else. And unfortunately, a lot of times they'll biopsy a nodule that they find, and then that's leaving scar tissue, and that's further increasing the risk of developing a cancer because that's going to be abnormal breast tissue in that spot where a needle or a knife went through. So a lot of the cause of breast pain has to do with imbalances in the hormones. And those imbalances can become chronic. And I know that my entire life I had lumpy, bumpy breasts. I didn't so much register breast pain, but I have a high pain tolerance. So you can't really go by that. But other people have the lumpy, bumpy with the breast pain. They call it fibrocystic breast disease. And I know that in my case, I had estrogen dominance because I also had fibroids, endometriosis, ovarian cyst, um, pelvic pain. Estrogen dominance is associated with colon cancer and with other cancers as well of the female part. So I just pulled up an infographic here that I adjusted for what we're going to talk about today on the screen. And we're going to talk about some solutions because I talked about the problem and I talked about the triggers. So let's talk about a solution today. So, of course, I'm going to talk about sleep first. This is my pet peeve. And this is where, many Americans are not getting sufficient sleep for various reasons. A lot of it has to do with our diet and the laxity of the muscles in the back of the throat, which has to do with vagal nerve tone. And that's another lecture, but the gut-brain connection has a lot to do with insufficient sleep. So we need to make sure we're getting sufficient sleep. If there is a sleep issue, like for instance, if you're not sleeping through the night, you should be talking to a healthcare provider. And if you're not getting sufficient answers from them, you should ask to be referred to a sleep specialist. Many of the people I see have sleep apnea or restless legs, and it's been missed. And then when they finally get a test, it's solving a lot of issues. So insufficient sleep causes chronic inflammation, and chronic inflammation contributes to nodules in the breast, and that can later contribute to breast cancer. So we want to get that inflammation under control. We must have sufficient sleep. That sleep can range anywhere from 6 hours to like 11 hours, 12 hours. Most people are kind of in the middle of the range, like that 7, 8, 9 hour span for most adults is adequate sleep. All right, so then the next category is healthy food and water. We all know what healthy food and water is, but we may not know how to attain it, and we may not know how to sustain it. So that's where, we can provide help. We have a health coach that works with us. We have access to nutritionists. Most people don't need a nutritionist. Most people need some help with figuring out how to get to the healthy food and how to keep it coming. So most people can do it right for a couple of days and they know what's not healthy. But then when it comes to sustaining behavior and avoiding processed and ultra processed foods, that's where it becomes an issue for people. Water, most of us know that the water coming through the tap has toxins in it, and can have bacteria. It can have too much chlorine. So I see now in Home Depot and Lowe's that they have free water tests that you can do to see what your water is like in your area. And they'll send you an analysis. You just send them in a test, a sample. And there are many, many water filters on the market. That's where I can help you with or assist with personalizing your water and what might be best. A lot of people ask me, is alkaline water best? Is hydrogen water best? This all depends, and you don't want to have these like the alkalinized water all the time. You don't want to have hydrogen water all the time. So we need to talk about what your needs are and what's the most cost-effective way to meet those needs. We also don't want to be producing a lot of trash and plastic. Plastic leaches into the food, it leaches into from the bottles into water. So we don't want to use plastic. And that is one of the toxins that I'll talk about next when I talk about the hormone assessment. But let's talk about exercise next. Regular exercise, and really to help your metabolic health, you need to do some weight training, especially if you're a woman. You need to do some weight training, but it doesn't matter who you are. You want to increase your muscle mass and decrease your fat mass. And when people have weight loss resistance, it's usually because they have estrogen dominance and chronic inflammation. And we need to figure out where that's coming from. That's a personalized discussion. You want to contact me. We'll provide our contact information below this. And you can get a free, very short phone consultation. If you have labs and whatnot and a longer history, please sign up for the 30-minute assessment and we can go over your information. So as far as a hormone assessment, this is where most people have not had a hormone assessment when they have breast pain. And it's just kind of an odd thing because in this type of medicine that I do, which is root cause medicine, and it's personalized, we know that there's usually hormone imbalances. That could be imbalances with the thyroid, the adrenals. We have 600 hormones in our body. I already talked about estrogen, progesterone. They're supposed to be in balance. When you're exposed to a lot of toxins, and especially if your liver cannot methylate and eliminate properly, and if you have kind of clogging up of your lymphatic system, this is going to cause chronic inflammation, which will lead to estrogen dominance, which will lead to the lumpy, bumpy breast and the painful breast. So we need to get a hormone assessment that is individually based, but at the minimum, we should be looking at estrogen and progesterone to see if they're in the proper ratio. All right, and then managing stress would be the final recommendation. And when you are very stressed and not coping well, that causes chronic inflammation inside the body. That later becomes estrogen dominance. So we want to balance all of these things. We really want to think about chemical exposures, toxic exposures. We want to think about the exposure to hormone therapy. Like, did you take birth control pills for a long time? As far as hormone replacement therapy in menopause, it's not as high of an incidence of having problems with breast cancer as people think. And that has a lot to do with how it is managed. If the doctor just puts you on hormones and never checks your hormones, there's a problem there. But if you're placed on hormones for a finite amount of time, just in that adjustment period of menopause, when you're having severe symptoms, it can be beneficial. It can help with the bone mass and preventing fractures. It can help with just the overall balance of the hormones, cause you to make less stress hormone if your hormones are in balance. But we need to see testing. We can't just put you on hormones and then just leave you and let you take it for 20 years. That is not correct. We also have to recognize that there's a difference between most of the prescription hormones that are used in conventional medicine and the type of hormones that we prefer. But sometimes we end up using some of the prescription ones because those are okay and plant-based. But the ones that we prefer are plant-based and bioidentical. Those are gonna most closely mimic our hormones. And I believe in using a smaller amount, enough to do the job, but not excessive. Because when we get into excessive, even if it's progesterone, if it's excessive, then we can get into trouble. And we can shut down some of the functions that are inside the body. So, all right, I've talked enough today, and I hope you ask some questions about this. I'm very concerned about breast pain. What else? Oh, I would like to talk also about mentioning that there are a lot of natural remedies that we can use, such as you probably heard of black cohosh, which is an herb. There's Vitex, which is also herbal derived, and it stimulates the production of progesterone in the body. There are several that can help with the adjustments, like during menopause. Some of these herbs, and some of them are in traditional Chinese medicine, like Dong Quai. There are also herbs or homeopathic remedies that can help with breast pain. And that gets more specific depending on the symptoms and depending on the person as to which homeopathic we may choose. I'm trained in homeopathy, so this could be an option that we could talk about, that I could prescribe. There's also lymphatic drainage that we can work on with a massage therapist. We can learn how to do ourselves, like every day, doing some tapping in some of the tissues. Qigong shows you how to do that. So you can go on YouTube and see some Qigong videos focusing on the upper extremities, which will drain the breast, like going down through the armpit and down the arm and back up the arm, goes back into the heart and into the circulation, the drainage. So there's also homeopathy that helps with drainage. So we have like a lot of tools that we can use, but we need to find what's going to help you. So go ahead and look at the link below, hit that link below, hit the like button. Also write comments if any of this has helped you. Have you heard anybody talk about this topic before? And what questions would you like to ask? I'm happy to try to answer them. All right, I'll do my best. All right, so have a great rest of your day. And I will probably post this in my Instagram, Facebook, whatnot, also LinkedIn. So you can grab it there. All right, take care.